Good afternoon. I'm Angie Pina, the Director of the Division of Services for People with Disabilities. Just want to welcome you all to our quarterly support coordinator meeting. Thank you for being here. Just a reminder that this meeting is being recorded and it will be available Friday on our website. We'll put that link in the chat for you. And just a reminder to also please mute yourselves and type questions into the chat or raise your hands. That just helps us manage kind of feedback and sound so that everyone is able to hear and participate. And I just want to say we really appreciate support coordinators. We see your role as vital in our service system. And we hope that these meetings are useful for you, that they provide information you need, and we're able to answer your questions. And just thank you for your patience, as sometimes it takes us time to find an answer to a question or find solutions as we work through changes in our system. So just thank you for your partnership. Thank you for the great work that you do. So just a quick overview of our agenda. We'll just go over some general announcements, staffing changes with DSPD, legislative updates, employment resources, training from our finance team, and then Medicaid unwinding, and then we'll have it open for the Q&A. We do try to keep half of the time open for that. So I'll just go ahead and jump into the announcements. First, we want to give you a chance to meet Tim Matthews, our new superintendent at USDC. So, Tim. I know there was an IM and I hope we're good.
Angie, it doesn't look like Tim has joined us yet.
We will get back to Tim. So we'll give you a chance to meet Tim as soon as he gets on. I'm really excited. I know I've talked a little bit about his background. I think he's going to be such a great asset in our system. But I'll let him introduce himself momentarily. In the meantime, we'll just talk a little bit about some of our other announcements. So with the start of the new year, please review your caseloads to determine who will be turning 19 in this coming year, right? Because anyone who is turning 19 needs to apply for adult Social Security. And if this isn't completed, it can result in a loss of waiver eligibility the month they turn 19. So please make sure you're on top of that. And then for anyone who is turning 65, once they reach that age, they need to demonstrate to DWS that they have applied for Medicare Part B. So doing this allows them to remain in the HCBS program. So these are really important to keep track of. And thank you for the work you do to help make sure these things happen so that people can maintain their services and maintain their eligibility. Just a reminder that as you are completing your annual person-centered support plan meetings, to use the person-centered planning discovery tools that are available in USteps. These can be found under USteps under the consumer assessment planning tools or employment pathway tool. We know there are other tools out there as well. And as you use them, just make sure you're uploading them. We want to be sure that we're really focusing on person-centered practices and engaging the people we serve to make these plans as meaningful as possible for them. Also, the Division of Continuous Quality and Improvement has updated their org chart on their website. We'll get that link in the chat as well. I know that, so just to make sure everyone understands kind of where people reside, the Division of Continuous Quality and Improvement is where Carrie Bambro's group is, right? So our oversight monitoring group sits within that division. Also, the program used to schedule UCANs has not been syncing with our Google calendars. So please make sure to schedule the UCANs a few business days early so that we can make sure we have a chance to update our calendars manually. And hopefully we'll get that resolved, but that's where we are right now. So we appreciate your help with that. Also, we have some changes to our DSPD staff. So Laura Ellsworth has joined the forensic civil commitment team as a caseworker specialist. She'll be supporting people who are civilly committed with some pretty intensive support needs. Kelly Unger has joined the assessments and support coordination team as a caseworker specialist. Cheryl Adamson is a financial manager 1 on Mel's team. So she works with Mel on that. For anyone who worked with Arlene. Then Jacinta Ofahangoe is a caseworker on Linnell's team. So that's our community transitions waiver. Emily Skadorwa is a program specialist on Bryn's team. And Austin Aitken is a financial manager working with Kristen on her team. So he'll be helping us in making sure we have some of the mechanisms in place that we need to related to some of our audits. So we're super excited for him to be starting. And finally, Rick Burrell is the new Master Electronic Business Manager. So that's Bob Downing's. That's the position Bob Downing just left. So, and just so you know, this is really new information. We just barely sent this email out to our staff about 30 minutes ago. So I'm excited that Rick accepted, and we're really looking forward to the work that he'll do. On our legislative updates, as many of you know, the legislative session started yesterday. So DSPD staff will be working hard during the session as we prepare and share detailed information with the appropriate legislators and the legislative committees about items included in the governor's budget. So on December 9th, 2022, the governor's office released the fiscal year 2024 governor's budget recommendations. So that starts July 1st of 23, ends June 30th of 2024. And we celebrate the governor's continued support for statewide disability services. These recommendations serve as a conversation starter with the legislature. And during the 2023 general session, then the legislature will determine what is funded and at what amount. You can view our full email that went out with more detailed information about DSPD specific items that were included in the governor's budget. So we'll go ahead and put that link in the chat as well. So I think Tim has joined us, and we can take a moment to turn the time over to him to introduce himself. Welcome, Tim.
Good morning. Excuse me, I don't think my camera is working, but yeah, my name is Tim Matthews. I hope you can hear me. I'm happy to be here. I've been in this position for about 2 months now, and I've really enjoyed everybody that I've met, and we have an amazing team here at DSPD and also here at USDC. So I'm just really excited to be here. My background I came from was community-based organizations, and so I've worked with our population in foster care and adoptions and in group home. And so I've been doing that for about 25 years across 4 different states. So Las Vegas, Nevada, and then Rhode Island and California for the last 10. So I'm excited to be here and learn more about this side of the work here at the state. And it's just been a great experience, and look forward to meeting all of you and working with you.
Thanks, Tim. And I think I've shared with you guys, he just comes with great experience in just trauma-informed care and really just least intrusive interventions, and has seen some good successes in helping people really progress and succeed. So we're really excited for his background, the positive successes he's seen, and everything that he's bringing to us in our broader system. So we're really grateful to have him join us. I'm going to turn the time over now to Timera to talk about some person-centered planning resources.
Thank you, Angie. The Person-Centered Planning and Education Work Group is looking for post-secondary transition age youth with disabilities, ages 14 to 22, their families and their support team members to pilot My Vision of Adulthood tool and a support team quick guide into their IEP transition plan. My Vision of Adulthood introduces a person-centered planning approach into the individualized education program, or for short, IEP transition plan. At each step, the student is meaningfully involved in their IEP planning process by utilizing a person-centered planning tool or tools and involving their support team members by their roles and responsibilities. Support team members might be family, natural supports, or service providers like DSPD support coordinators, educators, direct support, or vocational rehabilitation counselors. This increases collaboration and coordination of service agencies and supports throughout the transition process. To support the student and their families to implement person-centered planning tools into their IEP, the support team member can refer to the support team quick guide. So support coordinators, if the student and family presents you with a person-centered planning tool, like the integrated support star, the trajectory tool, or the employment pathway tool, the support team quick guide will provide you with information about the tool or tools and how you can use the completed tool to align their person-centered support plan, their PCSP, with their IEP transition plan. Next slide, please. As support team members, your involvement in the pilot project would be valuable in providing us with feedback and suggestions on how the tools are being used and if they were helpful in implementing person-centered planning into the student's IEP. Some expectations in participating in the pilot: use My Vision of Adulthood tool and a support team quick guide with your families and their IEP team from January to May of 2023. And at the end of the pilot, be contacted by email to complete a survey on the usefulness of My Vision of Adulthood in transition planning. So if you're interested in participating in the pilot, a Google sign-up form will be provided in the chat. And if you have any questions about this pilot project, you can contact the Person-Centered Planning and Education team at pcppilotproject@utah.gov. And the email will be provided in the chat as well.
Thanks, Tamara. I'll pick up from there.
Okay.
So the Living the Life You Choose resource, I wanted to talk a little bit about that. Living the Life You Choose, Preparing for My Person-Centered Planning Meeting is a new resource available to individuals to help them prepare for their person-centered support plan or PCSP meeting. It's written in workbook format and with the settings rule requirements in mind. It explains to each person about their choices and rights, what person-centered means, the person-centered planning process, and also includes links for several person-centered planning tools. Notes about the workbook. The workbook is a fillable PDF with embedded links to help navigate from content to the workbook pages. When it's completed, the person can print or share workbook pages with their support team at the PCSP meeting. Living the Life You Choose aligns and really could be used as a companion with the Person-Centered Planning Foundational Handbook for Support Coordinators, which has been around for a couple years now. Both of these resources and many others can be found on DSPD's Person-Centered Planning webpage, and we'll put the link in the chat there. The workbook can be accessed directly from this link that's going to be shared, and we can go to the next slide. So just know that that's there. Next update, DSPD is creating a survey to assess the implementation of the planning process from the perspective of the person. Note that when we talk about implementation here, that we're talking about the planning process and not necessarily implementing the plan itself or the impact of the plan. We're running a focus group for individuals receiving services and their families later in February, in person as well as virtually. More information will be coming out about that at the individual and family gathering meeting next month. Next slide, please. Okay. So as some of you might already be aware, DSPD has been developing new person-centered support plan software over the past 3+ years. The work group that includes families, individuals, multiple support coordinators, providers, and other partners. This is in response to the Home and Community-Based Services Final Settings Rule. That settings rule goes into effect in March of this year, March of 2023. We will be rolling out this new software and training over the next month with 3 in-person training dates and 3 other scheduled times for support coordinators to drop in for support and for questions. During February, all support coordinators will have the option of choosing to use the old version of the PCSP software or try the new software. In March, the only option that will be available is the new software version. We'd recommend that each support coordinator complete at least 1 PCSP with the new software in February. If you don't have a person on your caseload with a PCSP in February, we'd recommend first attending some of those trainings and maybe getting a head start on people with person-centered support plans in March. The introductory trainings will be held on the dates listed there, January 26th from 12:30 to 2:30, January 30th from 10 a.m. to noon, February 7th from noon to 2. And then the drop-in sessions occurring in February will be held on February 15th, 10 to 12, February 21st, 12 to 2, and February 24th, 1 to 3. An email with links to the USEP software trainings and times in January and February will be sent out later this week. Anyone is welcome to drop in at any point for some of those follow-up sessions. And if you'd like to schedule a specific time for yourself or your team, please follow the link to a scheduling calendar, which we're going to add to the chat now. If you have other questions outside of scheduled office hours on the new PCSP, please feel free to reach out to the Employment Planning and Inclusion team or the USTEPS team for any support or assistance. We'll add the email link to the chat. That's what I have. I'll give it back to Angie. Thanks.
Thanks, Brennan Timera. I'll go ahead and have Kristen Korniak. We'll turn the time over to her for some training.
Okay, let me pull something up really quick. Okay, so our first update is that in order to just simplify and reduce the workload to both support coordinators and DSPD staff, we've changed some forms, the Form 929, which is the respite intensive screening, and the Form 930, the enhanced supervision and rates form. You can find the new updated forms on the DSPD website. It's under staff forms. I know they were in a few different places on the website, so we kind of consolidated them all into one place, so you can find them under staff forms. And we also are sending out an email with this information too, so that will have the link about where to find them too. So most of the information on the form remains the same, but you will no longer need to have the form signed by a DSPD administrator. The forms can be approved and signed by the support coordinator for the client receiving the services. We do ask that you keep the completed forms as needed and upload a copy in your records or to the document section of USTEPS. So when you're completing an RFS request that includes what would normally have one of these forms, we still need the same level of information that's going to be provided to the RFS committee to review the case. But now the form is just recommended, it's not required. So you can submit the completed form that you filled out, or you can provide similar information through all the different areas in the RFS request. So hopefully that will help simplify at least a few steps in that process. And then our second update, we've had a lot of questions still about the emergency payments. So just wanted to go over that process again one more additional time. So the process and documentation for submitting emergency payment requests has not changed. That's still the same process for now, but we have updated how the RFS committee will verify that a situation requires an emergency or closed plan payment. The request will be reviewed and approved when there's been a documented change in circumstances. Things like loss in caregiver, change in housing circumstances, changes in behavior or medical support needs. We'll be looking for activity log notes that support the change. And requests need to be submitted no more than 90 days after the service provision. We will consider it a valid exception if a RFS request has been made at the time of the change in circumstances, but the RFS committee was not able to process that request before the plan closed. So we really are trying to get to the point where emergency payment or closed plan payments are only used for truly emergencies, and any other request, it needs to go through that RFS process and use steps. And then our last reminder for finance, we wanted to remind everyone the upcoming rollover. It will occur on January 26th. Use steps and UPI will be down from like 6 a.m. to 2 p.m. and during the time the rollover takes place. So please ensure that any RFS improved increases are added to the individual's plan before the rollover. The updated rate sheet and budget worksheets will be released on that day and will be on the DSPD website that you can download and get that information. Please just ensure that new rates and the new worksheets are used when any RFS requests are submitted after that date. And then just please work with providers to ensure that all invoices for services provided before December are successfully processed in CAPS before the rollover. And then we also ask that you hold off submitting RFS requests for services beginning after February 1st until after the rollover. Sorry, still getting over a cold. Final reminder, if you have somebody who has Camp K, then just remember that you need to adjust the individual's plan to accommodate the updated rates. So we have those on the screen that you can see, and it's also in the email that we send out about it. And I think that is all the updates for finance.
Thank you, Kristen. I think Joseph is on, and we're going to have him go over Medicaid unwinding as we look at how we transition from being under kind of a PHE, a public health emergency. So, Joseph.
Sorry, did I arrive just in time?
Perfect timing.
Excellent. Sorry, just let me get to the notes here quickly. All right. Sorry about that. I apologize for being a little disorganized here. So just as a reminder, perhaps, of how we got to where we are today. But at the start of the COVID-19 pandemic, the federal government declared the public health emergency, or PHE. I'll probably get stuck using a few acronyms as we go here. State Medicaid agencies were required to continue Medicaid coverage in order to ensure stability and access to healthcare. So even if there were changes in their eligibility, it wasn't necessarily reflected in their Medicaid coverage at the time. So the resulting effect, of course, is that Medicaid members did not lose coverage. They weren't switched to lesser coverage or programs which did not offer as many benefits, just to, again, ensure that they had that stability in their care. So during that time, and that has been in process since approximately April of 2020. During the window, Medicaid and CHIP enrollment has grown by 64%. Part of that is not seeing individuals fall off of the programs or otherwise lose eligibility. We have one of the highest rates in the nation as a result, or I think third highest is what we have recorded. So as of December of 2022, Utah Medicaid enrollment has ballooned up to over 500,000 members. There was some additional guidance that we just received at the end of December last year, passed by Congress, called the Consolidated Appropriations Act. So one part of this separated the federal public health emergency from this continuous enrollment policy. So technically, all of the declarations surrounding the federal public health emergency are going to continue to stay in place. But this plan allows us as of April 1st, 2023, or mandates us as of April 1st, 2023, to start phasing out this continuous eligibility requirement. So we're referring to this very regularly as unwinding. That's been part of the terminology that's been used. And starting on March 1st of 2023, the Department of Workforce Services will begin a process to review all Medicaid cases over the course of this 12-month unwinding period. So for pretty much every reason, Medicaid cases have remained open, including the need for reviews. I think many of you may be curious where you already know that families and participants are due for financial review annually, kind of what changes. Now this unwinding piece, there is the potential that following the completed unwinding review that a Medicaid member may lose benefits now. So that provision of continuous eligibility will be going away as part of this activity. So members are encouraged and are recommended to continue using their benefits as normal during this period until DWS continues their review. Where DWS looks at eligibility during this next year, we're asking members to wait until they receive their review before taking any additional action. So after February 10th, 2023, members can see their review date in my case. So if they wanted to log in and see when that is coming due, they'll be able to do that there. Something that has been described to us or that will take place is members that have been relying on their coverage on a month-to-month basis, they will be pushed later in the cycle. So perhaps as we have a chance to work out some of the kinks associated with unwinding, we have placed some of those higher need individuals, and certainly we would put waiver folks in that umbrella where particularly where services are needed on a day-to-day basis. They may be pushed later in that 12-month period. So some of your cases may not show up for a little bit. But members, again, they'll be assigned that review month and their case will stay open until that scheduled review month. Let's see. Sorry, and the big piece as well that we want to stress is keeping contact information current. A lot of people may have transitioned their housing situation during the last few years. A lot has changed since 2020. Phone numbers, addresses, it's very difficult for us to complete the reviews timely without adequate information. So again, strongly encouraging to find out both the status of that review month, and at the same time, in my case, individuals can check on the addresses and phone numbers that we have available. So strongly recommend conducting that review just to make sure it's current. Any changes can be reported to DWS. The numbers are, pardon me, not on that slide. The number for DWS, I think many of you already have it, and thank you. 866-435-7414. And then the My Case link is there as well. In addition, you're welcome to contact our health program representatives at Health and Human Services, where they can look up the same information and take down any necessary changes as well. And again, watch mail, watch email for any notifications on the changes there. And again, responding timely to the reviews, DWS will be processing several hundred cases during this time period, and ensuring that information is provided promptly, that any requests for communication are responded to, just again, to prevent any interruptions to Medicaid coverage are highly recommended. We'll also have a dashboard that we are maintaining on the Medicaid website for unwinding. So there will be just kind of pieces of high-level information and notice, pardon me, and any notifications will be on the site as well. And again, just continuing to stress the contact information portions, and just encouraging participants and families to stay on top of, again, requests for information and conducting those reviews. The unwinding toolkit will be available in both Spanish and English to assist with some communication barriers and some of our community partners as well as the information that will be posted on social media. So the coverage options, I think we're going to see this less significant perhaps to the portions for waiver members. Obviously, a big component is we want to prevent any coverage lapses or any interruptions to coverage. But any individual that may lose coverage for an eligibility reason, such as reaching the asset limit, they can receive coverage through the federal marketplace, but we know obviously for those that are participating on our home and community-based waiver programs, it's that needed support through the waivers that becomes more important. So there will be the opportunity as well to have benefits restored. So I again just strongly recommend working through that process, but there will be opportunities for those if a loss of coverage occurs where private insurance could be picked up for ongoing medical need. It is currently an automatic process. So as soon as that eligibility determination takes place and the individual is not found enrolled, that referral will occur, but not if it is due to an incomplete review or a failure to return paperwork. So, and again, the loss of Medicaid or CHIP coverage is considered a qualifying life event. So many of you are maybe aware that enrollment for or with healthcare.gov is currently open at this time, but even if this happens afterwards, again, it will allow an opportunity to access the federal marketplace due to that loss of coverage. So there's a few resources that we've gone by there. Sorry, I appear to be jumping around in the slides. I apologize. But again, can't stress enough the two numbers that are on the screen and that second bullet. Please make sure contact information is up to date so that we can reach individuals timely and ensure that those lapses don't occur. So, thanks, Angie.
Yeah, thank you so much, Joseph. I feel like we end up right. There are just a lot of questions, so I appreciate you coming to share that information. So that's our presentation today, and so we'll go ahead and get into the Q&A. I've seen that people have put some questions in the chat. We also received a few ahead of time. So we'll go ahead and start with the ones that we had initially received, and then we'll get to the rest of them as well. So the first question is for Kristen. It says, it would be nice to get further information, protocol, procedure for the way emergency payments are now being handled. I have only been getting trickles of information from coworkers or our billing tech, but no official guidance on exactly what is to be done. This is something that comes up quite a bit at the end of the client's plan years, and it would be nice to know exactly what we are supposed to be doing on our end. So I don't know if the presentation already helped, but I'll just give some time to Kristen.
Yeah, I was going to say the same thing. Hopefully what we presented is the information you needed. All of it's also written in the RFS directive at 1.49. But if you have specific questions, just email me and we'll go over that way.
Thanks, Kristen. Another question we had was, can we get additional information on, so we had a question about worksheets and them being locked. But I'm wondering if we have additional information on like what worksheets are locked, because they should be working the same way they always have. So if anyone has further information there, that would be helpful for us.
Angie, we asked for some follow-up info from the person who sent that via email and just haven't heard back yet.
Okay, perfect. Thanks. We also had a question. People have been getting, some of you should be getting letters from Medicaid that are asking you to like do kind of a revalidation. And it's related to like billing through Prism. And I know there's this thought that you don't utilize Prism. So just so everyone knows, and I don't know how familiar you are, Prism is what has replaced the MMIS system with Medicaid. So while your billing goes to DSPD, we're processing that through Prism. That's how you're able to get paid. And every Medicaid provider does have to like revalidate every 5 years. 3 years for some services, yours are every 5 years. And Becky Dalby has typically helped people process that. As you know, we have an audit that could be looking different in the future, but currently, if you could just please reach out to Becky Dalby, and she can continue to help you with that process. Joseph, I don't know if you have anything that you need to clarify after what I shared.
No, I think you got the detail spot on. It is a regular activity that's required by our federal partners at the Centers for Medicare and Medicaid Services. Some of you who may have been around may have received these letters roughly about the 4 to 5 year mark, where Becky assisted essentially doing that work on behalf of providers. So if you may be getting those letters to request it, it sounds like Becky can assist further with that, and we'll have staff on our side too to provide some help.
Thanks, Joseph. One of the questions that came up is, will USDC accept clients with a traumatic brain injury? So USDC is specifically an intermediate care facility for people with intellectual and developmental disabilities. That's its designation, and that's how people qualify for services there. So you have to have an intellectual or developmental disability. We know that sometimes people could have a brain injury that happens during their developmental years, and they would qualify under a developmental disability. So it could be that someone has a brain injury that is there, but their qualification is under intellectual and developmental disabilities. As it's unique with our waivers, right? Our community supports waiver is for people with intellectual disabilities and related conditions. Our acquired brain injury waiver is for people who have a brain injury. So that's the qualifying criteria for USDC. So we have a question, can caregiver compensation be billed outside of the state? So the same rules apply to caregiver compensation as apply to other service codes. And then we have, when will we get a copy of the new rates? I'll go ahead and give that to Kristen.
Sure. The new rates and the new budget worksheets will both be released on the same day as the rollover. We kind of do that so that there's not a lot of confusion about which budget worksheets to use. So they'll be there on the provider site of the DSPD website on that day.
And Kristen, you may as well stay on for a minute, because the next question is, what should we do with RFSs for services that needed to begin in January 2023?
Yeah, at this point, RFS committee is completely full with requests they're trying to get through so that we can get them in and implemented before the rollover occurs. So you're gonna have to wait till after the rollover happens to put that RFS request in. If we need to, we'll look at emergency payments at that point too, if you need something for January.
There was also a comment that just said, to avoid the bulk of end of plan emergency payment requests, a plan budget could be left open for a month after the plan ends to make adjustments to variable services such as respite and supported living when the billing comes in. So Kristen, I don't know if you have any comment to that.
Sure. Yeah, that's actually a suggestion we've heard. It's something, it's not available now, but it is something, a suggestion we've heard, we're thinking about, we're trying to think about the implications of implementing it and discussing it with the USTEPS team.
Thanks, Kristen. So we have a few questions that we probably are going to need to do some follow-up on. So one of them is, can you go over those out-of-state rules in more detail? Those are things that we've been working with Medicaid on specifically for a little bit, as we are looking to make sure we're following the guidance and expectations of CMS, right? Because there are some kind of limitations around how many services can be provided out of the state that you qualify in. So we don't have a more detailed answer unless like Joseph got something this morning and has something to share, but I won't put him on the spot for that. So that's something that we'll just continue working on. I think, so the PCSP rollout happening soon. When will the pilot team's information be meeting, and will there be time to adjust if needed? I think that was answered in the chat. Okay, so there is a question, and I am just gonna leave it open to our team to see if someone has the answer to this. If not, we'll have to follow up. So one of the questions is there a way to receive DWS letters via email on our end instead of just the paper letters? I don't know that any of us have the answer to that, but I will just kind of pause for a minute to see if someone on our team does.
Angie, this is Mel.
Hi, Mel.
Yes, we have discussed that with DWS about a couple of years ago, and they said that at that time they were not able to do it just because of how the system is programmed, but maybe that is something that we can ask them on the upcoming, I don't know when our meeting is, but it is certainly something that we can reach out to them as well. We have also asked about the possibility of having spend down automatically deducted from bank accounts. Again, at the time that we met with them, they said it's not available yet in the system, but that's one thing that we've been asked by some of the families. So we will reach out to DWS on that issue as well.
Thank you, Mel. So the next question is, are we still able to do visits virtually if needed? What is the current process policy for video call visits? And when or how may this be changing? So right now, the only allowance we have for virtual visits is under the Appendix K, and we do still have that allowance so that can continue happening. What we have asked in the past and continue to ask is that you assure you are meeting the needs of the person you are serving. Unfortunately, we've had some feedback and had some instances where, due to the lack of in-person visits, some people's services have been compromised. So it is really, really important that you're able to see a person, see their environment. You really need to be looking at how does that person communicate? Are they able to adequately communicate virtually? Are you able to understand their body language, observe what's going on in their environment around them, observe staff interactions with that person, right? There are just so many factors that go into services that you need to be able to observe and understand and help the person mitigate as needed. Some of those things really do not seem to be met through a virtual visit. So as we've asked from the beginning, please make sure that your visits make sense and meet that person's need. So they're still allowable. We still have Appendix K, but they really need to be about who you're serving and meeting that need. Kristen, it looks like the next question is for you. It said, so should we not be submitting any more RFS until after the rollover, even if it is supposed to start this month?
It's just a matter of the RFS committee can only review so many at a time. And in order for not to mess up the rates in the plan, it has to be active in the plan before that rollover occurs so that it gets the right increase. So at this point, they're kind of at capacity of what they can approve. So if we have situations where we need to look like an emergency plans, that will be the best step at this point for those.
Okay, thank you, Kristen. I don't see any other questions. Trying to scroll through and make sure we got them all. I don't see any other questions, but I'll
And there's one more
keep
in
it-
the
oh.
chat that just got put in.
Oh, thank you. Okay, so the question is there a determined date for the virtual visit allowance under Appendix K to end? So the allowances under Appendix K and 6 months following the end of the public health emergency. So when the public health emergency is declared at an end, we have 6 months to transition. Joseph, I don't know if you have anything to clarify. I don't want to misspeak.
No, you're good. We actually, I think it was announced earlier this week, or it may have been late last week. The public health emergency was extended again through April of 2023. So that would put our Appendix K allowances at least through approximately the middle of October of this year. So there is still a significant window where the flexibilities are allowed. And I guess just re-stressing Angie's point to ensure that what we're doing is still person centered, that if it is for a COVID reason to reduce exposure, those are all very good reasons, but it shouldn't necessarily replace in-person monitoring if families do require a higher level of support.
Thanks, Joseph. I have a question. Is there any discussion on how RFSs will look for SL3 that hasn't been approved after June? Kristen, I don't know if you are prepared for that question.
That's an interesting question. So just for clarification, are you wondering what will the services look like for SL3? Like, will we be replacing them, or I don't know, maybe I need more clarification. If you just want to email me with that one, I can.
Oh, yeah, or just overall, will we just have to submit on, one-time funding for our SL3?
Oh, okay. So if it gets approved again?
So a lot of the RFSs for the plan year, the RFS committee is not approving SL3 after June.
Right.
And so do you think we'll be doing just another one for the latter part of the year or plan cycle moving forward?
So right now we only have the funding till the end of the year. It's just one-time funding. So we are going to have to wait until we find out if that funding is approved, what it looks like, what it's going forward, before we really have any idea of what those RFS requests will look like after.
Certainly. And just real quickly, I've also had a lot of questions about SL3 that were approved for from the waiting list, and it's been ongoing. Do we know, will that just switch to SL1 if it's not approved?
Right, they will have to switch those to other services if SL3 is not approved.
Thank you.
So the next question is, where are we at making caregiver comp permanent? So I think the best thing to follow here is like the Legislative Coalition for People with Disabilities has been actively engaged with legislators. They have a group put together that's looking at how to make it be an ongoing service. In the governor's budget, there is a request for one-time funding for caregiver compensation. We have funding in our budget, as you look at our letter, from spousal caregiver compensation that wasn't fully utilized. So we would anticipate being able to shift some of that and have one-time money to keep caregiver compensation whole for this coming year. But if you're looking at like how to make it permanent, I would really reach out to the Legislative Coalition for People with Disabilities or the Utah Parent Center. They are both actively engaged in this. And are engaged with legislators, because that is really where the decision happens, right? So as we advocate for what's within the governor's budget, what's within the executive branch, you, advocacy groups, others, right, are able to lobby with the legislature for where you see the needs to be. And just being cohesive on that, it makes sense to be coordinating with the Legislative Coalition for People with Disabilities. And then the last question is, can we get a little clarification how budget utilizations are being determined? Kristen, I see you're ready.
Yeah, so if I guess I'm gonna make the assumption that you're asking once a justification has been submitted, how are we making that determination? So, if a justification is not returned, then it's just an automatic cut according to the formula that that Chad has put together. If the justification is submitted, we're going to look at a whole bunch of things. The first thing we're going to look at is that justification and see if it just clearly identifies that need is there and that it needs to continue. If it's kind of the gray area and we need more clarification, the RFS committee is looking at the last 4 years of someone's services. They're looking to see, well, is there a pattern of utilization, or is this just a one-time thing, maybe due to COVID or something like that? So they're looking back 4 years. They're also looking at RFS requests. They're looking at things like how the budget plan total and the budget max, if there's a gap in between theirs. So they have a written set of guidelines that they follow that goes through, and then they come at a determination on a recommendation of what that budget should be like. If you have other questions about that determination, we do have, I think we have the policy up there on the DSPD website you can look at that covers it, or you can also send an email to me.
Thanks, Kristen. So another question we have is, if Appendix K is going to October, does that mean that caregiver compensation could go until then without legislative determination? So one of the things that's always been the situation for us is for caregiver compensation to be implemented, we need to have both the approval and the funding. So for us to be able to continue it for another year, we need to be able to have that resource available to cover the cost for that service, for us to be able to continue to maintain that. This, I'm not sure if this was, I think this was a follow-up for you, probably, Kristen. It says it was supposed to be, and it sounds like on this, like getting into this level of detail, it sounds like it's going to be best to just reach out to you to kind of go through a specific situation. So I think for that question on the, like, what it was supposed to look like on the RFS or the budget utilization, please do just reach out to Kristen. Hey, Kristen, there's another question. Is there some way to review the justification after it's been submitted? I know support coordinators are submitting the justification, so I'm not sure.
So all of the justifications come to a Google form. So we have those on a Google spreadsheet. So I guess, are you asking, like, you wanted to go back and review what you had submitted for an individual client, if there's a way to do that? And if so, you could send me an email and I can tell you what's on there. We are still working on getting the whole process, whole system set up in UStep. And once that happens, then you can track it really easy. But for now, it's still through Google Sheets.
Thanks, Kristen. So there was another question. Can you post the determination guidelines on the website so support coordinators know how to justify needs? They feel like there needs to be just more transparency.
I'm pretty sure it's already on there in one of our directives. So let me find it and I will send it out.
Thank you. And there just have been people sharing the fact that, right, that Senator Harper has a bill out requesting caregiver compensation, be an ongoing service. So another question is, should individuals on the waiver also qualify for SNAP like SSI? I am gonna see if there's someone on here who is prepared to answer that. Otherwise, my thought is it's actually on a case-by-case basis, but I'm not the expert on that by any means. So I'll see if there's someone on our team that knows. And if not, we'll see what information we can get.
Yeah, and I guess that's the recommended short answer, is definitely to check in with DWS. There are different criteria that are applied to SNAP or food stamp assistance than Medicaid or SSI. SSI and Medicaid in Utah pretty much walk hand in hand. They use the same rules for determination, but food assistance does not. So would recommend they reach out to Workforce Services to have that evaluated there. It's somewhat likely with moderate income, but there may be household considerations that come into play that may make them ineligible.
Thank you, Joseph. So Kristen, there's another one for you. What time frame after submitting justifications for utilization should a support coordinator anticipate hearing from the reviewer?
Good question. And also I found the directive is 2.5 person-centered budget review. So under internal directives, that's where it is. You can find the whole process, justification, all of the questions you might have. We are doing monthly reviews, so we'll send it out, the justification. You have about 10 days to respond. Then between those 10 and the end of the month is when the RFS committee is reviewing those justifications. So far, we've met that target every single month, so it should be by the end of the month that you receive information about what that review is like.
Thank you. The last thing that's in there at this point is Governor Cox has indicated that the bachelor degree requirement for state government jobs is being removed. Will this requirement be removed for support coordinator jobs? I think that is a good question. Right now, our requirements are based on federal criteria, but that is something that we can look into with the Medicaid team so that we have a good understanding of that requirement and what is out there. I don't know, Joseph, if you have anything to add there.
Not directly. I think as it makes sense for each waiver program, the provider qualifications that are made for each service are reviewed for, again, appropriateness for the service delivery. We don't see that necessarily affecting what's in the waivers.
Okay, thanks. Okay, it looks like we don't have any further questions at this time. Just a reminder that our next support coordinator quarterly meeting is Wednesday, April 19th. Our next family and self-advocate quarterly meeting is February 8th. And just thank you for attending and so much for the work you do and for your time. Have a great day. See you.